Hey, it's Patty, and I just wanted to review, well, what are mast cells? So just a little information on mast cells in particular, not the mediators, not the whole presentation on mast cell activation syndrome, but what's a mast cell? So very briefly, I'm just going to review this so that you have some general information and understand the differences between mast cells and mediators, and what might be causing the issues. So mast cells are a type of blood cell. They do coordinate with the immune system. They're a pretty big role player in the state of the immune system and how the immune system is responding. It's really a communicator, which we'll talk about this. So it's found in all of the body's tissues. It helps with the body's defense system. It's kind of like the sentinel that's on lookout to see what needs to be addressed and what doesn't. And it acts as a coordinator. This is really important. It's a communicator, coordinator. Called the air traffic controller, which I'll explain in a moment. But it releases these different mediators, histamines, leukotrienes, interleukins, things that are required. We need these to take care of inflammatory triggers, invaders in the body, irritants that come along. But at a certain point, and we won't get into this within this lecture, we'll talk about more in the mast cell activation syndrome lecture. But there comes a point where the mast cell turns from being helpful to becoming more what we call pathologic and causing some of the problems. So too much of a good thing. If it can't help control the inflammatory process that's happening, it can actually start creating part of the problem. So this air traffic controller analogy, which I use a lot, and this is really important to understand, especially when we get into treatment and figuring out if things are working. The mast cells are very much the communicator. It's telling things what need to be done. It's responsible for interpreting information and releasing appropriate mediators to take care of the appropriate things. And when you're having faulty communication at the mast cell, if we think of an air traffic controller who, for whatever reason, is not having the best day and just not doing the job that we would like to see, we might have chaos that's happening. Too many planes landing on a runway, accidents happening. So the air traffic controller is like the mast cell. It is responsible for taking in all of the information that's happening in the body and responding appropriately with how the body needs to respond with these mediators. But again, if we have something that becomes off and the information is not being relayed correctly, or the connective tissue is affected in different ways, so the medium that the mast cells are in is not supporting it appropriately, or there's too much inflammation and it can't keep up anymore for whatever reason, different for everybody, those mast cells can become pathologic and they become more dysfunctional than helpful for some people out there. So that's what we see as a problem with the communication at the level of the mast cells. We'll talk about the mediators in a different lecture. But the mast cells are absolutely everywhere in the body. So this is where we get some confusion as to, it kind of looks like it's everything. Could it just be one thing? Well, it could be, but we're still going to want to know why the mast cells are misbehaving. So yes, it's important to understand that this can be causing problems everywhere in the body, pulmonary, so the lung system, respiratory system, cardiovascular, dermatologic, or the skin, gastrointestinal, so the gut and the GI system, musculoskeletal, and the neurological system. So we see this happening in all of these tissues. So you can have mast cell reactions in any of these different tissues. And again, we're talking about responding and communicating. That's the responsibility of the mast cell. So if we have anything, if we talk about those feedback loops that happen, and this is why it's tricky to figure out why somebody has a mast cell problem, is these feedback loops that occur, it can be a chicken or the egg scenario, because the mast cells coexist in the pulmonary space. If we have chronic pulmonary irritation, chronic sinus infection, chronic bronchitis, that can make the mast cells upset over time. But also, if somebody has a mast cell related issue, it can cause a problem in the pulmonary system. So this is why it's important to work with specialists, especially to figure out why you are having the symptoms that you're having, because it can be a chicken or the egg scenario. But again, just important to understand that the mast cells are the communication piece. Okay, so the mediators are the inflammatory piece, that's what we're feeling. but the mast cells are the ones that are responsible for dictating who goes where and what you're supposed to do while you're there and how many go there, and it's time to stop working there. So that's what happens with the mast cells is it loses its ability to communicate efficiently and really do the right thing for what the body needs in the moment. And just a lot of references that these are from the mast cell lecture itself. So there's a lot of them, but didn't want to leave them out for anybody who wanted them as a backup. So just again, little tidbit on mast cells, the communicating piece of the immune system to the connective tissue. And then we'll break this down a little bit more and have a bigger lecture on mast cell activation syndrome as more of a whole. Thanks.